Okay. Hey, what's up, everyone? Welcome to the live. Just getting set up right now. So we are live on Instagram, Facebook, and YouTube. So if you guys want to check me out at a different place and like and follow me all these other places, I can't believe, like, this is phenomenal, these results. I mean, like, they put these up and I was shocked. Um, it still amazes me what is possible with liposuction. Now, was this one a fat transfer as well?
Mm-hmm.
Yeah, so liposuction and fat transfer. So this is what typically would be called a Brazilian butt lift. Okay, so I wanted to pin that comment. Let's see if I can do that now. Nope, dang it.
Are you live already, Mr.
Yes, sir. Hey, Ron, could you just put that comment up there
You want me to put it
and I'll
myself?
pin it. All right, how's everyone doing today? Hope you're doing well. What's up, Paula? Karen?
Oh shit.
See, all these Instagram names, I can't even pronounce them. What's up, everyone? How's everyone doing? I am, like, exhausted. I spent the entire day sucking fat out of people,
Mm-hmm.
making the world skinny one person at a time.
There's a little.
Okay. What's
Maybe.
up? You guys have any questions today? I'm gonna try and make this one. I want to end by 4 because I'm exhausted. I'm really tired right now. You can't believe how tiring sucking fat is. I'm sure a lot of you actually do understand that because it's I mean, when I'm working really hard and I'm sweating the whole time, I like literally I have my assistants wiping my brow to get the sweat off, and you can see my forehead's all shiny. I didn't even prepare or get ready, just came straight out from sucking fat to come talk to you people.
Mm-hmm.
So I hope you appreciate it. Okay. All right. So one of my favorite procedures now is that 360 lipo. We're just getting awesome results, and you can see this is Angelica or Candy Lover 89 right behind us. She had that 360 lipo, which is liposuction of the entire waistline and including the lower back. So what you can see with this one is that you can see how it essentially lowers her waistline and elongates her torso. So this is something that I tell shorter individuals, if you are short and stocky, it's really important to have a smaller waistline to elongate your torso. And not that it makes you taller, but it's going to make you appear to be taller because you have more space between your shoulders and your waist. Um, as we've removed that fat from all the way around the waist, including that lower back, and you can see how it really makes the butt pop out. Now the cool thing about her is we did not do any Brazilian butt lift or fat transfer to the butt on this one, but you can see it appears that the butt is popping out in comparison to the before picture. Now this is basically an optical illusion because the butt is not any bigger per se. It's just shaped better because we took the fat from the lower back. Let's see. What's up, Tina Gray?
Sophia got a 360 today.
Um, 360. What did I do? I don't even remember what I did today. I don't think I did a 360
Mm.
today.
So Sophia keeps saying she got a 360. I guess they're talking within themselves.
Okay. I think it's awesome that the previous patients are communicating with each other and communicating with new people that are interested.
Tina Gray will be back on the 16th to get her backside done.
Tina's coming back. Nice. Have you ever used a stomach fat transfer and transferred it to the butt?
Yep.
Yeah. Here's the thing. Fat is fat. You can take it from anywhere and transfer it to wherever you want. And now we just commonly do that to, we transfer the fat to the butt or the breast. We also transfer fat to the face, to fill in like these nasolabial lines or give fullness to the cheeks. And that's typically an anti-aging procedure when you're transferring fat to the face. And it's similar to how a lot of people will get fillers in their face as an anti-aging tool. And fat is just a more permanent solution, as the fat will stay for a longer period of time, as opposed to the temporary fillers that you might use, like Restylane. Is that right? Juvederm. Um, so these are the things that we can do with the fat. If some people have some weird stuff, like they might have like dents from trauma when they were younger. They might have scars that are indented, and they want to fill in that area. Fat can be used for so many different things, and I think the thing that I think that that's going to be most useful for in the future is the use of stem cells. So stem cells can be extracted from fat and injected back into you. Let's see. So let's see. Kayla Patterson on YouTube is asking about. She says that she has PCOS, and she asked her doctor about getting liposuction, and her doctors thought that it was a great idea, and it might actually help. So, I'm not an expert on polycystic ovary. I think that's what it is. But I can tell you there's a lot of unintended uh, benefits from liposuction that I've seen over the years. So many, so that it's just it amazes me on the improvements that people will experience. And this is kind of a cool one. Now, this is, if you look closely, and you guys probably can't see it, but the before picture, she's obviously not that big of an individual, but she had very loose skin before the procedure. And you can see she's got a lot of stretch marks. I believe she's had a few kids. And even though she's not that big, she's got the belly's folding over at the bottom there. But however, after liposuction, the skin's retracted quite nicely, and that fold has gone away completely. And that's despite the looseness of the skin. So I know a lot of individuals will, if you're going to plastic surgeons, they inevitably will tell you you need a tummy tuck, and it's not necessarily the truth. Some people would benefit more from tummy tuck. It kind of just depends on what you want, and the look that you're going for. A tummy tuck is primarily to cut away skin and um, take away stretch marks and things of that nature. So stretch marks aren't necessarily, they're not going to go away with liposuction. They may get smaller, but they're not going to go away completely. So if your goal is to completely get rid of stretch marks, then you literally have to cut them away, which means tummy tuck. However, the problem is that if they don't cut away enough skin, you're still left with stretch marks, and you have a huge scar. So it's one of the reasons I don't particularly like the procedure. Most of my patients are trying to avoid a tummy tuck, and they're getting liposuction, and they get fantastic results. Most of them are very happy with the results and don't necessarily need the tummy tuck, because they don't want the scar, they don't want the tough recovery. It's very expensive. It has to be done under general anesthesia. So there's lots of reasons why people are trying to avoid it. Okay, Denise Williams. So the 360 lipo is all the way around. That's correct. So 360, just like the word, we're going all the way around the entire waistline. So that's from the breast all the way down to your natural endpoint down at the bottom, whether you have a fold. Um, the sides, the love handles, and the hips to create that hourglass figure, and then the lower back, it shapes your lower back and creates more arch to your back, as well as it makes your butt pop out a little bit more. So that's the benefit of the 360 lipo. It's it's really just it's creating that waistline. It creates just nice smooth lines. I've been getting very good at blending the lower back into the bottom, into the butt area, and shaping the butt, and it's awesome. In fact, I've done this for my wife. I treated her lower back, and she was just telling me yesterday how happy she was with her results, and it's been about 10 months now, and she's, you know, funny. She told me that she's actually recently noticed in the last week or so that she continues to get smaller, and it's 10 months out. So you know, I think that people have residual swelling that uh, continues for months and months after the procedure. Let's see.
Is
There's
it, can you tell them about they're asking about how much down, about the contest?
Christopher. Okay, so let's talk about the contest really quick. So, hey, can we get something on the screen? Um, so the contest that we're running right now is for 3 areas of liposuction for free. And the people that we are targeting are those individuals who are kind of on the fence right now and want to get liposuction. You're ready to get liposuction, you're just kind of holding off for whatever reason. We want to encourage you to jump in and get your procedure done now. This is the time to do it to prepare for the summer. So in order to enter this contest, you have to place your deposit. Now, the cool thing about that is that it's going to be a very small sample size in comparison to our previous contests. So, these are only people that are willing to put, their money where their mouth is and put the deposit down. Uh, those are the people that we're looking to reward. Now, we're gonna we're gonna announce the contest on a quarterly basis. So I forgot what the date was. I think it was it was June, April, May, June. So it was July 1st, I believe it was, would be the date. So 3 months from April 1st, whatever that. If someone can figure that out for me. We'll be announcing the winner. It'll be done live. Now, you don't have to wait to get your procedure. If you get your procedure and you're the winner, then we'll just reimburse the money back to you. So it'll be 3 areas of liposuction. So whatever the equivalent value of that is, we'll reimburse it back to you. So you don't worry. Don't wait. If you want your body to be the shape that you're looking for, you're ready to make a change in your life, you're ready to have more confidence, then jump in now. Now's the time to do it. We haven't done this before, and this is going to give you, like let's just use round numbers. Let's say we had 100 patients in the next 3 months, and you were one of them. So that means you have 1 in 100 chance of winning 3 areas of liposuction, which is phenomenal odds. I mean, way better than the way better than the lottery, right? So I love this picture. This is just, it's like such a nice butt. And, you know, you can see the arch in the back in comparison to uh, the arch in her lower back on the before picture. It just makes her look like you're standing up more straight, whereas in the after photo, it makes it appear as if she's sticking her butt out, like she's got more arch to the lower back, and that is just an optical illusion. Is because we took the fat away from the lower back, which just created that. It created the shape, the arch of the butt. I call them the golden arches because we're creating those arches to the butt there. But then we want to blend that into that lower back so you get that smooth transition. So you just, I mean, it's super sexy. So if you're looking to really make those changes, and hey, can you put up that picture of that boxy individual, that I think that first picture that you had up? I mean, it was just, it's just incredible what's possible with this procedure. And everybody's different, so you're gonna see these pictures now, and it's like it's amazing results, and you're like, I want that. And the truth is that not everybody has the potential to get these kind of results. And so what does that mean exactly? Why don't you have the potential? So everybody's body is a little bit different. Everybody stores their fat in a little bit different place. Everybody's the quality of fat is different, meaning some people is really the fat comes out really easily, and other people it's extremely difficult, which is why you'll see a wide range of results. Um, and as far as your expectations, like I don't want you guys to think that everything always comes out perfect because it doesn't. I've done thousands and thousands of procedures, and I'm sure I have my fair share of failures. Um, but here's the thing: is that as I do the best work that I can do, and that's all you can ask for, right? For anybody, I've done thousands of these procedures. I have the experience. I have the knowledge. I have the past results to prove that I'm able to do what I say I'm able to do. So, but with that said, it doesn't always turn out the way I want. I mean, I do things consistently. I've developed patterns. Um, to try and get consistent results, and I've been able to get those consistent results. But every once in a while, things don't turn out the way that we want. And in most cases, what I found is that, hey, Crystal Vera, I know that you wanted me to read your comment. I totally missed it. I'm not going to go searching for it. If you can write it again, I'd
Crystal
appreciate
Vera.
that. If Ron, if you could find that for me,
See.
she's asking me
Oh,
to.
asking Deanna, I wonder your, if it will interfere with a C-section.
Okay. So if the question was, is it will it interfere with the C-section, or if you have a C-section, will it make any difference? And the answer is no. C-section scars, or any scars for that matter, if you've had abdominal surgery, the scars are challenging. It can affect the results, and sometimes it can limit me. However, I've done so many of these procedures. I've worked. I have lots of cool tricks to get the best results, and in most cases, they don't even slow me down. But it is what it is. So, um, God, you can. This is just it's really this is the coolest thing, and I love how you can create the shape. There's arch to the upper part of the butt, and I mean it's so cool, especially if you have lower back fat, and it appears that your back is straight, and you're stand when you're standing up, but if it appears that you're boxy, and you're standing up straight, and there's no arch to your back, that like I can change that in an instant, and it's the coolest thing ever, and I really it's something I really enjoy doing. You see any questions, Ron?
Yeah, there's a gal, where is it? I have seen lots of bad infections with fat transfers to the butt. How bad can they get? Have you ever had anybody?
Infections with fat transfer to the butt. Um, I haven't. And let's see. I'm trying to think. I don't think we've had any infections with fat transfer. Um, we've had some seromas, which is basically when the fat cells don't get absorbed, and they end up dying off. The body has to reabsorb those dead cells, and sometimes it has a hard time doing it. Um, so I've seen that a few times over the years, but it's not common. Infection wise, all of our patients get antibiotics for the fat transfers. All the patients get antibiotics for 10 days, which should cover you in that critical time period of where you'd be at higher risk for infection. So it really hasn't been an issue for me. Not saying that it's not possible. It's definitely possible, but it's usually another cool picture. It's usually a technique kind of thing that if you're not using proper technique, the fat itself can get exposed to bacteria, and then when you inject it into the butt, it can cause an infection. So we take careful measures to make sure that that doesn't happen, and we've been
Got
pretty
hundreds
fortunate.
of questions on Facebook.
Okay, fire away whenever.
Uh,
I see one really quick. That I'm in Louisiana. How long would it take? Would I have to stay in Nevada? So 70% of our patients are flying in from out of state, so that's not a problem. We do our consultations over the phone. They're free. And for individuals that are flying in from out of state, I recommend that you fly in at minimum the night before the procedure. Do not fly in the same day, because if your flight's late, or you have any issues, you'll miss your procedure and it'll cost you dearly, and I don't want to see that happen. So fly in the night before the procedure, you'll get the procedure the next day, and then if you're in a big rush, you could fly out the next day, so you're spending 2 nights in the hotel. But I would prefer if you stayed an extra day, it would just it's a lot easier, less potential for problems. So I would say 3 nights in the hotel would be ideal. Um, so I see there's a bunch of questions about costs, and each individual is different. So I'm not going to tell you any specific cost in here. However, liposuction we charge $12.99 per area for liposuction. The question is which areas do you need and how many do you need? So that's what we're going to discuss in your consultation. Fat transfer, that process is $2,000 in addition to liposuction costs. So um, these are all things if you go to our website, all the pricing is right there. We're very upfront about these things. um, However, you know we just don't know what you need. I can't say anything without seeing you. So we need some pictures. We need to have some idea of what your expectations are, what you're trying to achieve, and we'll give you the recommendations that we recommend to achieve the results that you're looking for.
Do you also offer laser lipo?
Yes, so laser lipo, we use Smart Lipo as the brand of laser that we use, and Smart Lipo is going to get you up to 57% more skin tightening. And how that works is we pass this laser underneath the skin, and it heats up the undersurface of the skin, causing a contraction. And it's also been shown through studies to simulate collagen growth for about 6 months after the procedure. And you can see this picture. If Ron just took it down, but yeah, so you can see this young lady had a smart lipo. You can see how far that belly is sticking out and hanging down, and you can see that fold starts on the side of the abdomen, and afterwards it's completely gone. The cool thing about people like this is that I really like how in the before picture, I know we cover up the breast, so it's hard to see, but the belly sticks out further than the breast, which that's not the way it's supposed to be. It's supposed to be the breasts are sticking out further than the belly. So if we can change that proportion, it's dramatic. It's a big change, and it's just one of those things visually that it makes such a big difference. A lot of these women that have the big bellies, they're wearing looser fitting clothes, which you never really see. The I guess the shape of their body. So when you take that abdomen away, you start wearing more form-fitting clothes, and the breasts are more obvious then because they're sticking out further than the belly. Um, K. Juliana, you asked how much is the deposit. Our deposit is 25% of your procedure cost. So once you get your free consultation, um, we'll give you a quote so you'll have an idea, and we'll tell you obviously what the deposit is at that point. Now, for the contest, you don't necessarily have to get the procedure now. You just need to place a deposit now. So if your funds aren't right at this moment, you can book out in the future. So place your deposit now, which enters you in the contest, and then book out further. So you can book out 2-3 months if you want to do that. But just you got to get your deposit in now before we announce the contest winner at the end of this quarter. Okay. What is the downtime and how much time do I need to take off afterwards? Okay. So this is for Melissa Mitchell on Facebook. What is the downtime and how much time do you need to take off afterwards? So, part of this answer is, how much downtime. Our statistics show that most patients, about 87% of patients, are able to get back to work within 3 days after the procedure. Now, with that said, it just depends on what kind of job you have. And it also depends on the individual, obviously. So some people are going to tolerate things better and have the ability to tolerate things and get back to work quicker, while other people might take longer. It just depends on the individual. Um, so and it also obviously depends on what kind of work you do. If you have a sedentary type job, then you can get back a lot sooner than someone that's got a very physical job. So it just depends on that. Trying to give you guys some basic answers.
What sections are the stomach? Two sections.
humble myself. She says, I want my waist to be 24 inches in a BBL. You know, I think this lady here has something like that, but I can't really promise any of that stuff. I can't. All I can do is I can get out as much fat as I can to make your waist as small as possible, and add the fat to the butt. All I can do is the job that I can do. Each individual has their own potential, so just going to do the best that I can do. And if you're one of those lucky ones that have phenomenal potential, then you're going to get better results. But for the most part, people get great results. We do very well with this.
Is there a cap on the fat being sectioned out?
There's recommendations or guidelines to not remove more than 5 liters of fat. But with that said, it's a recommendation. So I'm going to complete the procedure, and if we need to do what we need to do, I gotta make sure that we get a good job for you. The limitations are more so I'm concerned about the amount of numbing medication that we use. Lidocaine can be toxic, as with any other medication, if you use too much of it. So that's really the concern. Um,
Mm, this is a good one.
okay.
So I had a consultation with Sonobello, and they said they can get fat that's behind the muscle. Is this true?
If you want to take the risk of killing people, then.
It's, yeah.
I guess I don't know if you guys heard that. So apparently, someone went to Sonobello to get a quote, and they said that they could take the muscle behind. I mean,
The
sorry,
fat.
take the fat behind the muscle. So this is what we call the visceral fat. So the visceral fat surrounds the internal organs. It's actually for protection of the internal organs. Um, and some people can store a lot of their fat behind the muscles surrounding those organs. Everybody has the fat there, but just the way you develop, some people will have more fat there than others. And the people you can see this is really simple when you see these men. Men tend to carry a lot more fat behind the muscle than in front of the muscle, and women are the exact opposite. They tend to carry more on the outside than they do on the inside. But men, we call it beer belly, and I'm sure everybody knows this guy that his belly is like hard as a rock, and you try to pinch, and there's like no fat to pinch. Um, Yet his belly's like sticking way out, and he looks like he's pregnant. So that's what we consider visceral fat, and it is not safe to puncture through the muscle and take the risk of sucking up internal organs in order to get that fat. I don't know anybody, any doctor or any recommendations. I've never read any studies. No one has ever said that they would attempt this. Now, with that said, I'm open to possibilities. If I could read said as possible, maybe I would consider it. But at this point right now, it's not possible. And I would not take the risk of going behind the muscle to get the fat. It just at this point it doesn't make sense for the simple reason: if you stick the cannula through the muscle and you puncture into the bowels, you have major complications. And it's just, I mean, we're doing cosmetic surgery here. It's just not worth it. Not for something like that. I mean, the visceral fat is something that I always recommend. Diet and exercise is the best thing for that. It's the safest. In any of the fat on the outside, the subcutaneous layer of fat, that's the stuff that we can get, make a big change there. And like I said, women typically are going to have more subcutaneous fat than men. So that's what I would recommend there. Any other questions?
There's,
You've been debating.
if someone is prone to blood clots but not on blood thinners anymore, can they still have the surgery?
Okay, so the question is if someone's prone to blood clots, but you're not on blood thinners currently, are you still a candidate for the procedure? And the answer is I don't know. um, with someone like that, we would get you cleared medically. So through whoever your primary care doctor or treating physician is, we would talk to them first to see what they recommend. I don't know you, I don't treat you, so um, I wouldn't give recommendations on what you can can and can't do. I would get you medically cleared. But with that said, there are a number of patients that have had blood clots in the past that were on blood thinners that we stopped the blood thinners. So there's a protocol that these doctors will typically go through. There's a protocol of stopping the blood thinners so you can have procedures because obviously there's other more serious surgeries that you may need to have that they would need to do that. So they actually have a protocol where you stop the blood thinner for a week prior to the procedure. You get the procedure, then they can start injectable blood thinners immediately after the procedure, then get back on like something like oral blood thinners like Coumadin. So it is possible. So I don't just because I wouldn't clear you. I would have you get cleared by someone else. That doesn't mean anything because as long as your treating physician is okay with it, and we can discuss the situation, and everybody's on the same page, then we can go ahead and move forward with that.
The lady's asked us a couple of times, will
Okay.
lipo clear cellulite on the upper legs?
Will lipo clear cellulite on the upper legs? The liposuction technically is not for cellulite. So I wouldn't say get liposuction to reduce the cellulite. Liposuction is the removal of fat. However, in the process of doing the liposuction, in many cases, I break the fibers that are causing the cellulite, and the cellulite improves after liposuction. So that doesn't necessarily happen with everybody. Just in general, I would tell people to your expectations. You should expect comparable dimpling after the procedure if you started with dimpling before the procedure. Now, um, with that said, I can't even count. There's been hundreds of patients that the cellulite improves dramatically um, just with liposuction. And a number of times I remember specifically the patients come back to me. And so, not all the patients come back to me, but I remember this one girl came back to me and she had like these little tiny dimples all over her entire thigh. And we treated the inner thighs and the knees. And when she came back 3 months later, it was substantially smoother only in the area that we did liposuction. So my answer is it is possible. And so I don't like to restrict myself or anyone else. I believe everything is possible. So um,
Here's a little.
yeah, so this is you can kind of see these thighs here. Um, you know, everybody's different. Again, everybody has different potential. So, what you start with is going to contribute to what you end with. So, if you have a lot of loose skin before the procedure, there's no magic. We do skin tightening, but it doesn't undo everything. So, there's always going to be some limitations that each individual has, and that's something that we'll discuss at your free consultation.
Does lipo help with PCOS? I don't know what that is.
PCOS, polycystic ovary. Yeah, I talked about that earlier in this live, but I don't know if it helps with it. Apparently, this one patient's doctor said that it does. I don't know. To be honest with you, I mean that's not my field. I just suck the fat out. But like I said, there's a lot of unintended benefits of liposuction, so um, it might help. I've heard of people say that fibromyalgia has helped with their specific pains with fibromyalgia, which I don't know how it works, but it does. So anything's possible. Let's see. Jesse, she asks, is this an in and out procedure? Um, I'm not sure what you mean by in and out, but it is. You come in and it's a day procedure. So you come and have the procedure, then you leave that day. Our patients are awake throughout the procedure, so afterwards you walk out, and many people can go out to lunch right after the procedure because you're feeling pretty good.
How about fat stomach from prednisone use?
Prednisone.
Prednisone?
Okay, so prednisone is a steroid, oral or injectable steroid. They use it with a lot of like let's see, what is it? Like asthma, respiratory issues. So steroids are for uh, circumstances where you have inflammation because it's a strong anti-inflammatory. So they use it a lot in orthopedic surgery. Um, And again, like I said, respiratory issues and many other steroids are very common. So one of the main side effects of steroids is people gain weight. So obviously they don't like that. So you know, liposuction is a great option. When you gain that weight, we can suck it off. It's it is what it is. Someone asked, can you transfer fat to the lips? Yes, it is possible. Literally, I can transfer fat to any part of your body. So, wherever you have a problem, wherever you want, and fat is used as a filler, so it fills the space. Cool pictures here.
How long does it typically take for swelling to go away and for results to show?
So this is a something that everybody wants to know, and I can't give an answer for that. I can give you statistics. I can tell you what some people have experienced, but the truth is, the swelling is it's your own body. I can't predict exactly what your body's going to do. There's a huge, wide range of normal for this procedure. I've seen some people where the swelling goes away as quick as 2 weeks, and other people it takes a year. So, me personally, I had liposuction and I had quite a bit of swelling, and the swelling took. I mean, when I say this, I say it took about 6 months, but to be honest with you, it was probably closer to a year because I continued to see improvement for about a year. So, I believe that most people will continue to have some degree of um, mild swelling that will be residual and continue in the area treated for up to a year, maybe even longer, to be honest with you. So, um, you know, you just have to be patient. The fat's gone immediately, so you get this instant gratification that the fat's gone, and a lot of people will see results very early on. If not immediately after the procedure. However, the final results are when all the swelling's gone, and so that means it could take 6 months to a year for the final results. But be patient. It's okay. The soreness goes away after 2 3 weeks usually. The bruising's gone by that time as well. It's just the swelling. Your body's got to heal, and everybody's different. Some people get sick more often than others, and I don't know why. It just is what it is. Their body's different. Um, some people are able to tolerate things better than other people, and it is what it is. I'm sure there's reasons within that individual, but you know th- I'm not here to guess. I'm not here to try and figure out some of these small nuances. I'm here to suck fat out of people and make your body smaller and increase your confidence. But there's a lot of things that I can't explain, and I'm not going to pretend like I know everything.
Okay, this little gal's asking, could you ask him about a botched tummy tuck 18 years ago? Also had severe infection, so have a lot of scar tissue. Can he still do lipo
Okay.
with so much scar tissue?
So, let's. Okay, so the question was,
Paula Martinez
this
told me.
individual, Paula, had a botched tummy tuck about 18 years ago. Had lots of scar tissue. Had an infection. And the question is, can we still do liposuction on that? The short answer is yes. Um, Now, technically, this would be considered a revision. So, revision means when you've had liposuction or something in that particular area before. So, you had some type of surgery in that area. So, now we're revising, we're doing it again. And so, that is absolutely possible. Now, when you have scar tissue in there, it's going to limit things to some degree. But like I said, I have lots of tricks as the trade to make things easier and better. So I've done so many revisions on patients that have come from other doctors. It's crazy. In fact, Mexico is one of my biggest suppliers. So, all those people that go down to Mexico thinking they're going to get cheap liposuction or cheap tummy tuck or cheap whatever, they're just looking for something cheap, and they get cheap results. Most of those people are very unhappy, and they barely, it's crazy.
Last week, a gal died
In Mexico.
from 2 weeks after
Yeah.
getting lipo from Mexico.
So, Mexico is, I don't want to say that it's impossible to get good results down there because, it's possible. Anything's possible, right? But, I know there's a lot of people that get poor results or no results. Like when they quote you for full body liposuction, I'd run the other other way because, I mean, there's some things that are just dangerous. You know, you can't do too much. Your body, you know, these procedures they're traumatic to the body. So, I mean, imagine like if you had a burn over your entire body. I mean, it's traumatic, right? So when we're sucking fat out, the body has to heal itself in all these areas. So it's like it only has so much potential to heal, and it's got, you know, the various the hormones and the cells that need to help heal this. I mean, it's like liposuction is taxing on the body, and I don't think people really, you know, just because you can come in, have the procedure, and leave doesn't necessarily mean that it's that easy for your body. Your body, it takes time to heal these things, and you know, it's I wish we could speed things up, but it's just it is what it is.
Can an area be liposuction more than once, such as arms, thighs, and stomach?
Yeah. So again, this is can, can an area be liposuction more than once? And the answer is yes. And again, that's considered revision liposuction. So if you had liposuction from someone else and they didn't take out enough fat, which is extremely way more common than you think, you know, if you didn't get the results that you're looking for, and you know that there's still fat there, that's good news because that means I can make a difference. I just did a revision on actually it was a doctor, a local doctor here in Vegas, who went to one of the plastic surgeons down the street from me and got liposuction about 3 years ago, and he said that he didn't see any results, and the guy charged him like 15 grand. So that's frustrating. I'm sure it's really frustrating. You know, when people get those kind of results, I think they tell all their friends and family how, you know, like, liposuction doesn't work and it's nonsense. You should never do that, and you know they get tainted just because they were exposed to someone who doesn't know what they're doing, which is a shame. But with that individual, I got out. So this is after they had liposuction somewhere else. I got out 4 liters of fat, and it was beautiful, pure fat, 4 liters. He got nice V shape, you know, the guys like to have, flat abdomen. He had a little fold over in the front, so that went away completely. So it is possible, you know, if you've gotten screwed over by someone in the past, hopefully I can help you. You know, so
I see you using the long stick going back and forth. How, do you know you're not coming close to some body parts you need?
okay, so the question is, you know, I'm using a long instrument to suck the fat out, going in and out, in and out. How do I know that I'm not jamming it into, you know, internal organs or some other body part that's important? So that all comes down to technique, and and it's really not as complex as you think. I know a lot of other doctors struggle with the technique, but I mean, I guess I've been doing this for so long. It's easy and it's second nature, but it's really quite simple. My technique is different than other doctors. I know a lot of other doctors, they do this flat hand technique where they're pressing with the flat hand and they pass the cannula underneath, um, which is fine. And I do use that technique with to some degree, but I like the pinching. So I like to pinch. So when I pinch, like with the, I'm trying to get in all the cameras. So when I pinch with my hands, and I go in between my hands, and so the benefit of that is that when I'm pinching, you can only pinch the fat. You're not going to be able to pinch the muscle. So when I pinch the fat and pull up, I pull it away from the muscle, and then my fingers down here, my tips are about where the muscle is. And so as long as I stay above my fingertips, I'm golden. I mean, and that's a sweet spot. So I can jam away and do whatever I want in that zone, and you know, almost, you know, I'm not gonna say never, but it's very very low chance of having any problems in that zone.
How long after reaching your goal weight should you wait to have procedure done?
Say that again.
How long after reaching your goal weight should you wait to have a procedure done? You don't.
Yeah, I don't really care about weight. So you know, I don't even check. I don't even check weight. I don't ask. I mean, we ask for it just to have reference, but it's not. I'm not. It doesn't matter to me. Fat's fat. So if you have fat, I'm going to suck it off. I don't care whether you're, you know, 350 pounds or, you know, 95 pounds. So whenever you are ready to get your fat sucked off, you know, schedule your appointment. Someone asked about, do I have to be put to sleep? So everything that we do is under local anesthetic, so you're actually awake the whole time. That's why if you go to our Facebook page or our website or YouTube, you can see videos of patients that are awake during the procedure, talking. In fact, we've done procedures live where the patient themselves are answering questions live while they're getting liposuction. So it's pretty cool. If you haven't seen that yet, go check it out. Go check out our Facebook page. We have the videos there as well as on our YouTube, and they're on our website too. Again, there's some people asking about cost. You know, all of our basic fees are listed on the website. However, uh, like liposuction is $12.99 per area, but the question is, how many areas do you need to accomplish your goal? So without seeing you, I don't know that.
Is the consultation with you or your staff?
The consultation is with my staff. Brandy, she has been with me from the beginning of my practice. She knows more than probably any doctor in the country about liposuction. She's dealt with so many procedures and patients. She's really good, and we communicate really well. Again, she's been with me for it's almost 9 years. Probably it's over 9 years. She's really good. But if there's any questions, because obviously there's always going to be those weird situations. People have concerns or weird body types. So on the challenging situations, she always calls me in, and I definitely review pictures or I'll meet the patients if they're there. So we're flexible. If you need me, I'm there. But I'm busy. I'm busy sucking fat out of people, so uh, it's better to have my staff do the consultations, and they're really good. We got good people.
You don't travel anywhere. We're just located here.
Yeah, yeah. I'm located here in Vegas, so if you want your liposuction, you got to come here. Let's see it. Sophia says that she's from Ohio and she came out here a few days before and flew out 38 hours after her procedure. And if I remember correctly, Sophia, you had the 360 lipo, so which is a pretty big procedure. Um, so you gotta keep in mind. So the concerns about traveling. So after any liposuction procedure, we use fluids, lots of fluids. So it's saline mixed with the lidocaine. So we inject a lot of fluids into the area that we treat, and after the procedure, those fluids drain out. Now we try and push as much of them out immediately after the procedure, but uh, inevitably you're going to continue to drain for the next few days. And typically it'll be the most in the first 24 hours, and it'll be a slow trickle for the next 2 or 3 days. So if you try to leave quicker, it's more of a potential issue, right? Especially going through airport security and all that stuff. I mean, if you're sore, you're aching, you're draining this fluid, and when the fluid drains out, it comes out is mixed with blood, so it looks like this like pinkish, Gatorade like fluid coming out, and it tends to scare people. So, personally, I would wait, but we have people that push the limits, and I'm all for pushing the limits. That's the way I live my life. So I don't limit people. If you want to try stuff, try it, but you just got to realize that there's going to be a higher potential for bad things happening. Oh, Cherry Berry, she said, I love what you've done for my body. See you back here very soon. I think it's awesome. And we just had two patients today that were previous patients. Um, and I think it's so cool that it's such a testament, testimonial, I guess, I don't know what the right word is for that. You know, patients come back, they're happy with the results, and they're happy with the way our staff treats them. They like me, and that's it's so nice when they come back just to hear that stuff. And for you that they're watching and you're wondering, is this guy for real? I mean, like, there's a bunch of people on right now that have had procedures already with us, and you can communicate with them. Um, I know Sophia was just there. Tina Gray was just there. And it's, I'm not looking at all the names, but there's a lot of people out there that have had procedures at My Shape Lipo, and they're communicating online. So you can, like you ask them, you like reviews. Who knows reviews? I mean, those could be our competitors. Could be, I mean, we got some stupid reviews from people, just random people. I don't even know who they are. They're not patients of ours, but we get bad reviews from I think they're competitors. So you can't really trust reviews. You got to take that stuff with a grain of salt. Even the positive stuff. I mean, theoretically, any business you could pay people to leave reviews. I mean, it's really it's stupid nowadays the way the system works. Um, but patients, people that have actually had the procedure. I mean, hell, some of the Tina Gray, she just had a procedure. Did we do live with Tina?
Yes.
Yeah. So I mean, we literally went live with Tina during her procedure, and so now she's here, and I mean, you watched her procedure. I mean, there's no doubt that I did her procedure. So
And she's coming back.
yeah, and she's coming back for more. I think this is her fourth
16,
time.
yeah.
17 is like
Mhm.
she's addicted. That's all right.
Yeah.
Tina's I want to say she's like 51, 52, and this is helping her just regain her youth and feel good again. And I know, we treated her, we did 360 in two different procedures for her. That just I think that was a cost issue, but she's now got her butt's popping out, and like at 50 something years old, she's posting pictures of her butt on Facebook, which is like I know she never imagined ever doing that, but I think it's the coolest thing. So, gotta appreciate that. Karen, she said, how much is the procedure to know the deposit? So, um, you know, Karen, it just depends on what you're treating. Our costs are $12.99 per area of liposuction, 2,000 for the fat transfer process, in addition to the liposuction charges, and 650 per area for the laser skin tightening if you choose to do that. So the question is, what do you need? And the deposit is 25% of whatever your procedure costs are. So the next step, whenever you guys are ready, is getting your free consultation. You can call us at the office, or you can check our website. There's a link there to get the consultation as well. And we'll probably be posting a link here shortly. Let's see. Okay, Andrea, I think I mentioned this earlier. I don't know if this was about the. She's Andrea Donadio. She says, I'm on Coumadin for idiopathic PE. I'm going off Coumadin soon. Would I be at risk for having this done? So, anytime you're taking blood thinners, it's obviously a risk of bleeding. So stopping Coumadin for a week is the recommendations. However, we probably want to confirm with some studies to verify that your bleeding time has come down to acceptable range. But it is absolutely possible to do this procedure um, despite you having bleeding issues. We just require that you get cleared medically through your treating physician, and in some cases, we'll institute a specific protocol um, to follow up with blood thinners after the procedure if necessary.
Couple three have already asked what is the 360 procedure?
Okay,
What
so
area?
360 liposuction is signed so in the front of the abdomen, the sides, which creates more of that hourglass figure, and the lower back. So all the way around, all the fat that your entire spare tire. We're gonna change your spare tire out. Let's see. Someone asks, "What's the difference between the Brazilian butt lift and the fat transfer to the butt?" Technically, they are the same, one and the same. It's just another terminology that people use. Brazilian butt lift was a term that someone coined and has been very popular. Technically, it's fat transfer to the butt. Uh, the Brazilian butt lift is a great procedure, but it's two parts. So it's one injecting the fat into the butt to make it larger, but more importantly, it's the liposuction in the surrounding areas. So as you can see in this person here, it's she had liposuction in the waistline, so the love handles, the hips, as well as the lower back. And when we do that, it allows me to shape the upper pole of the butt to create those arches to the butt. When you take the fat out of the lower back, it creates that shape, that arch to your lower back, and it makes it appear that your butt's sticking out further. So then when you add additional volume, that's where you get that pop and that big dramatic change. So, good question. What about neck fat and double chin fat? So yes, absolutely. It's, oh my god, that's the easiest thing ever. So if you have a double chin, you got to get that taken care of like ASAP. Um, it literally takes 15 minutes, 20 minutes maybe if I'm going slow that day. But it's incredible to lose your double chin and create that jawline here, because a lot of people, what happens, their face goes right into their neck, and so they collect fat right in this area and through here, and so you don't have that defined jawline. So what we're doing is we go above the jawline. So if you draw a line from the corner of the mouth to the bottom of the ear here, all the way across, we're going to take everything above this line here, and we stop right about there. So we get everything there. So above the jawline, we're taking the fat there. Then we take everything in the neck here, and so that'll get rid of the double chin, as well as create that jawline. And it's like it's night and day. And it's, if you have a double chin, if you have this issue, it's like you got to call now, because there's no reason why you need to be embarrassed and avoiding pictures. And there's no reason to have a double chin this day and age. I don't care who you are. It's affordable. It's considered one area. The results are phenomenal. I'm like so behind on questions.
They're just bombing us today,
Okay,
but they're helping answer.
good.
Uh,
Yeah, so I know there's a lot of people on here. We've had previous patients. A lot of people have been following us for a long time. Um, see, someone says Jorley. This is on Instagram. Says something about she got quoted 25,000 for liposuction. Um, it wasn't with us, so I don't know what that's about. Um, but that's excessive. Okay.
I wanted to have tummy and love handles done, but when I talked to consult, they said you usually always want to do the lower back too, which I would love, but don't have enough money.
Okay, I wasn't paying attention. I was reading.
It's,
What was the question?
I wanted to have tummy and love handles done, but when I talked to consultant,
Uh-huh.
they said you usually always want to do the lower back also.
So, I mean, look, I like it because it's the best. Look, my recommendations are going to be for the best results, not for the cheapest procedure. If you tell me to stay within a certain budget, I'll give you the best for that budget. Otherwise, I'm going to tell you what is going to be the best results for you. And so visually, what I see. So you tell me what you're looking for. If you're looking for the cheapest procedure, I'll give you, we can make it the cheapest thing, and we'll do very limited things. But if you want the best results, then I'm going to give you my recommendations for the best results. It is what it is. Huh. Keep seeing this 25,000. I'm seeing it on Facebook now too.
Yeah,
Who's getting quoted 25,000?
I don't know.
Okay.
If somebody has lupus,
Yeah. So any medical problems? Really cool arms here if you guys haven't seen this. Any medical problems, we're going to ask that you get medically cleared through your treating physician. This is like any other procedure. So, um, you would just get medical clearance. And once you get medical clearance, we can go ahead and move forward. Um, Someone asks, can men do this too? Yes, absolutely. Men
man boobs.
compromise about 30% of our patient population. Men like to do their chest, take care of man boobs, and the abdomen is most common with men as well. Also the chin, very common. Okay. Yeah, see, Stephanie's talking to
Yeah.
Jordley. Like, I think, what's the name? Jordley? Jorley. Yeah, Jorley. You know, I can't. You certainly didn't get quoted 25,000 here at My Shape, unless you're talking about multiple procedures, full body liposuction. So I mean, there's a lot we can do for you, but the get the consultation. Call up our office and get your consultation. It's 12.99 per area. So
What is large volume lipo?
large volume liposuction. I don't remember what the definition exactly was, but it's no, we're done on Instagram.
It's
So large volume liposuction is, taking out large volumes of fat. I believe it's more than 3 liters of fat. So we do a lot of large volume liposuction, make a huge difference in people. Um, but so we just crossed the hour mark, guys. I'm gonna call it a day here. I appreciate you jumping on with me. If you want to enter the contest, the first step is getting your free consultation. So give our office a call. The time is now that you want to get this done for the summer. If you're preparing for the summer, you got to get this done now so you have time to heal. Um, so call up our office, get your free consultation, and enter our contest. The contest is going to be announced at the end of the quarter, which I believe is July 1st. And we're giving away 3 areas of free liposuction to one of the individuals who placed their deposit during that time period. So place your deposit now to enter that contest and see if you can win some liposuction. And don't worry about you know getting your procedure. If you get your procedure, then you end up winning the contest. We'll just reimburse you. So keep it real simple. Odds are going to be very good for winning this contest. So get in now. Give our office a call, 702-818-5476, or check out myshapelipo.com. All right. Thanks for watching, guys.